श्री विजयपुरम के स्कूल ऑफ नर्सिंग द्वारा एनिम्स के लेक्चर हॉल में आज दीप प्रज्वलन और शपथ ग्रहण समारोह का उद्घाटन समारोह आयोजित किया गया। इस अवसर पर स्वास्थ्य सेवा निदेशक डॉक्टर सुजा एंथनी मुख्य अतिथि थीं, जबकि जीबी पंत अस्पताल के चिकित्सा अधीक्षक डॉक्टर एम के साहा सम्मानीय अतिथि थे। कार्यक्रम में अतिरिक्त चिकित्सा अध्यक्ष डॉक्टर अर्पिता साहा तथा मैट्रन जॉयना रियाज भी मौजूद रहीं। नर्सिंग स्कूल की छात्राओं ने स्वागत गीत गाकर अतिथियों का स्वागत किया। इस बीच स्वास्थ्य सेवा निदेशक सुजा एंथनी ने दीप प्रज्वलित कर समारोह का उद्घाटन किया। इसके बाद स्कूल ऑफ नर्सिंग की प्रधानाचार्य डॉक्टर शाइनी वर्गीस ने दीप प्रज्वलन और शपथ ग्रहण समारोह के महत्व को बताते हुए उपस्थिति का स्वागत किया। साथ ही उन्होंने स्कूल ऑफ नर्सिंग के इतिहास और महत्व के बारे में भी बताया।
School of Nursing is running for the last 24 years, and with the able all faculty members, all students are going very nicely, and they are really learning a lot. Because this week came to know when we were posted in out islands, and the senior nursing officers from GP Pant Hospital will also agree that these students who are studying from Andaman Nicobar Islands, they are really doing very well in their professional work. So all parents should be happy for that, because your children are studying in School of Nursing, GP Pant Hospital. So this is a great pleasure for this day that we are all here to witness this program.
Lamp lighting is followed by oath taking ceremony. The oath, which is administered to the newly inducted nursing students is known as Nightingale Pledge. The Nightingale Pledge is historically significant as it was the first explicit statement of ethics for nurses, named after Florence Nightingale. It set the foundation for nursing standards and established the importance of patient confidentiality and ethical treatment in healthcare.
इस दौरान INHS धनवंतरी की प्रभारी मैट्रन लेफ्टिनेंट कर्नल YT मिनीमोल ने उपस्थिति को शपथ दिलाई।
I solemnly pledge myself before God and in this assembly to practice my profession faithfully. I will not take unknowingly administer any harmful drug. I will do all in my power to elevate the standards of my profession. All family matters coming to my knowledge and the practice of my calling.
This is the promise of love. There shall be seasons refreshing, sent from the Savior above. Showers of blessings we need.
अपने भाषण में उन्होंने इस समारोह का हिस्सा बनने पर प्रसन्नता व्यक्त करते हुए इस पेशे के महत्व को समझाया.
When I came into this island, people used to say mainland and island. So I could know the difference between the lands, islands and the mainland. So I've undergone all years of service in every part of the India, high altitude, peace, everywhere, wherever the organization calls me, we are ready to go, and that's the service has been. And myself, I've done my BSc B.Ed, and I was being called, and I was asked my parents that you have to be ready for the nursing profession. So where does the B.Ed stands and where does the nursing stands? So that was, so it's written. And when I think about today's day, I've really overwhelmed that I have to thank Madam Bibi, because we are all two good friends. At all times she always have a word with me, and she always wants me to come over here. And this day I'm really overwhelmed, and I'm really thankful to her, because today if I have to stand here in the presence in front of all of this audience, my dear students, and if I have to be a person to inaugurate this lamp lighting ceremony and the oath taking, I'm being blessed. So I take this opportunity as a big pride and proud. Where I stopped with saying that I was a BSc B.Ed, my dad comes in a day and he says me, go for the training, a nurse. And I have to say only yes, because I've been trained and I've been brought up in such a way to only to say yes to my parents. In the same way, my training was also to say yes, because I'm not very skillful in speech, because we are being trained to say only yes, and that's was the trained and mold, and respect and obedience was the two things that we been taught for the nurses, and I think so. And today, as the lamp lighting and the oath ceremony, we have to think about a very important person. I am sure that all would have known about this pioneer, the modern nurse, the pioneer who, Florence Nightingale. She has left a great legacy to us. Always on my 30 years of service, we have only thought about the 3 C that she has taught. Can anybody just recollect those 3 C's? It's very simple. Once you complete the 3 years of service, it's not a very big thing to overcome. Only 3 very simple words. It's compassion, commitment, and competence. Competence comes the third. The first one is compassion. Recently, my gynecologist told me, Madam, she called me and she said me, Ma'am, compassion is very important. And I just stood and looked at her, what she was about to say. And she said, any person can give medicine. Any person can give an injection. But compassion, where does it come? It comes from the nurse. When do you call as a nurse? Nurse is empathy or sympathy. These are the 2 words that's inbuilt in a nurse. And that's what she said. Yes, she was true. The gynecologist, when she said me on that day, it was true. Anybody can do any professional things when they've been trained. But this part of compassion, care with compassion, that verse, it's very simple. And if we give a care, and that's what our pioneer, the Florence Nightingale, taught us. And I think everybody knows about the small story that when we think about this Florence Nightingale. And you remember she has got other name also. If you could remember, Lady with the Lamp. Usually everybody has got a nickname, is it? So this pioneer, this legacy. Lady has got a name as a lamp, lady with the lamp. And why and who has named her? It was the soldiers. The soldiers where they were wounded with pain. The whole day they are been with pain and they were out of crying with pain. And who was the person to look after 24/7? We were the nurses. She went near to the patient. She has given hope. And you have seen that with the lamp, a very simple kiddie story. It was that lady with the lamp, she goes, we have done many role plays. We take the lamp on our hands and just go near to the patient and we have always on our training time, we have heard that medicines and injections doesn't that cure. 50% is the care that we give. Just go near to the patient. Just take 5-10 minutes near and just give him a hope. And there you can see the smile with the pain, is it? Have in my service, I've seen if I work in the male wards, in the medical wards, after the patient get on discharge, they come near to me and say, Jai Hind, ma'am. Is that to reply saying that, thank you, ma'am. And in my family ward, I can see the family patients coming over saying, Namaste, ma'am. Kabhi, we will never forget you. That's the word they say. Recently, last week, I had a lieutenant. She's coming over, running over to my office and she's saying me, ma'am, I've got a small greeting card. It was a paper, normal white paper, just folded together and written, Nurse auntie, I will never forget you. It was a small kid, a pediatric girl, who was running out fever with pain. The whole 24/7, maybe that night duty nursing staff would have looked after. And she comes running saying, this is the card. And she was so overwhelmed. She was happy. That is, there is no need of any commendation or any badges over your shoulders. But that little happiness that she has got, she brought that you know that pediatrics, children's art of innocent. That word, nurse auntie, she has not named the name. That's what Mother Teresa, her good verses, if you remember, she says that they may not remember your name. That is true. Nobody will never remember a name, but they will remember the work that we have done. Is it not true? Some years, I remember some 20 years when I went back to Delhi, I was a renal transplant a matron over there. After 20 years when I went to Delhi, one big crowd, a patient running over and calling me Mini Madam, and I just turned him and saw, he runs and comes into the crowd and waves his hands towards me. And he says that, Madam, yaad nahi hai, you gave me a second life. And that's the wonderful word when I heard. I couldn't recollect him, I couldn't remember him. But that person, he remembered me after 20 years. That was really giving me that happiness. That's what I say. The first word, compassion. Commitment. Here last years, I could overhear saying that, ma'am, compassion to hai, nahi, but commitment, does we do have? Yeah, after 1 o'clock, yeah, my duty is over, I have to leave. Let the second sister take over. That commitment, aajkal nahi dikh raha, ma'am, nahi ho raha hai, kyun? So that's the thing she says, commitment nahi hai. So where we are lacking, if we have got the commitment, that responsibility that I have to do, this is my work. A profession has got different ways, but nurse, when we talk about the word, it's a noble job. It is a God's calling. Everybody who ever been the student of here, is a messenger by the Lord. Maybe through your parents, or by yourself, or by your friends, or by your elders or seniors, would have told, come on, go for the nursing job. There are lots of jobs available. You could have gone for a degree, you would have gone for the college. But why this profession? Because it's a calling of the Lord, as I believe. That's what I have given an example that I've done some other profession and I've just come over because it's a calling of the Lord. Because He knows that this individual has been decided. He is a person to dedicate, devote and give service for the patient. He knows. The Lord knows, and that's the reason He has been selected to you. And that's what my nurses, you people have to be pride. Have you ever heard that? We are being blessed and we have to be pride and proud for one reason, because we are the witness for the birth and the death. Kabhi hum socha, we are the only one to be at the time of birth. When I heard these verses also, it was true. At any time of the birth, we are the nurses standing there. And in the last breath, we are the only nurses stand there. Is it not correct? So the Lord knows that you are the one. And that's what He has selected us. And as our Florence Nightingale always says that, You come into the service. Whoever come into the hospital, they are with sick, they are with pain. Do not harm. Always remember, my young students, always, when you know that they are sick, do not harm. Any clerical works, if you write in a paper, any error, you can tear the paper and put it into the dustbin. But if you do any error in the medical, there is no nil error. That's the verse we have been taught to us. So we have to follow according to her. And I remember my son saying that, Mummy, this profession is very good, nursing. I could have learned nursing. He's in Canada. He says me, Mummy, your nursing profession, mein itna opportunities hai. So I said, then you could have learned. I didn't do that. I'm very sorry. And now I'm repenting. It's correct. Wherever you go, abroad, we are called as military nursing service. But we were called as Malayalam nursing service because we Malayalis from the whole Kerala, all people used to go. I remember every family has got 5 of them, and one is a person have to be dedicated for the nursing. That is to care the sick, and one is for the spirituality, and one have to look after the nation. One person pakka ek nursing, army person hoga, and other one goes in the abroad because he have to earn for the family. So 5 of them. So that's a trend in Kerala. It goes on. So 5 people, and so we used to call it Malayalam nursing service. And now the trend is gone because people are aware of the nursing profession and its importance. And so it's coming down, and we have seen that it comes from different state, all people come over into the nursing. And also I'm very proud saying that I always love the US President, Donald Trump. The second time he has come, I've heard verses in some days before in the YouTube saying that give a preference for the first car parking for the nurses. Maybe that sounds little thing, but it gives me pride because, and he knew it. The only person any person have to come, the nurses is already available over there in the hospital, and one more nurse have to come and relieve. So he understands that the car parking should be given a first priority for the nurses. So I don't know, somewhere down on the lane, I just love this person, and that goes on. And again, to my students of the 20th batch of the GNM students, even the last 2 years, you have been coming to our hospital. We have shown you the way, how the working pattern and how we have been working and what are the opportunities. And for a greater news, I could like to say that my new commanding officer just joined 2 days before, and he has given an opportunity saying that contract basis he won the GNM. Maybe I'm happy that the ma'am's letter has come over, and as and when he read, he had a view that he want to take a contract basis the GNM students. So I'm happy that if for the year of 2025, so 25 and 26, we are going to take a contract basis for 5 years, and that goes on. So that was a happy news that I received this news yesterday. So I thought this will be a good message for everybody. And my dear students, and I'm very happy that the male nurses are here. And people outside, people used to think that, no, kya nurses, male nurses, kya karna hai? But they are unaware. If you go abroad, they want you only. And I think now, as I've told last year, the students also, that they need the male nurses. Because every parents, after the children's go away for work, leave their parents alone, they want the nurses to look after. So as and when the old age goes on, they need people to care. So we are the only person, as I said, we are the person, we have been selected. So and then comes to the competence. The medical officer says, you all are competent. When they give a diagnosis, and our children are very ready with all the diagnoses, they full definitions, and with all brief they stand with all reply. But where does your compassion and where does your commitment goes? That is our part. It is of 100% if we have to do that. Medical officers has got their own part. But nowadays the generations, the nurses think that by giving a good diagnosis and replying, and you never go near to the patient, you never touch. Until you go near to the patient, have a few minutes, have a talk with him, you can see the smile. When I go to the ward, everybody give me a great smile and they say that, oh, madam has come. Last 3 years I'm in the Adam. Otherwise, I was always in the ward with 80, 90 patients. And as and when I come into the night duty, they say, "Ha, madam aa gaya." Oh, madam to बहुत rude था. Why do that word? This madam is saying the other madam is rude. Everything it goes for the nurse, is it? If she does or me does, all the same. But the patient thinks that nurse, a person of angel, she have to talk good words, and that's the way. So we have been trained in such a way, and I also as a teacher, and I also request you should be obedience and with respect. If these two things goes in for the service, you can just come out with all full-fledged nursing officers. And we were asked, I remember when on my training, we were asked to wash the washroom. So I was asked, we were asked like after 3 months of probation, we were about to take a suitcase and we were about to go home. We were trained, we were asked for an officers and we were asked to wash the washroom. And after the 4th year, when we were commissioned as a lieutenant, she called me and asked me, you know why I've asked you for to wash the washroom? I said, still we didn't know what was the answer. She told, if you do it by your hands, by yourself, you will come to know. And only then you can teach others what is the work and how is the work and how you can do it. And we were taught about the Riles tube. Today we insert a Riles tube to a patient, but we were trained in such a way that we ourselves have to insert the Riles tube to ourselves to know the pain. That's what the training was, to teach what's the pain, how does the pain goes for the patient. If we know the pain of the patient, if we are in their shoes, we know how to go on. On those days, we didn't have any of the equipments. Maybe the new generations will remember. We hardly had. But all the patients went happily discharged, saying hi and bye. And we could remember. But nowadays, I've seen lots of equipments. Yeah, you put a electronic one, day or BP is there, or electronic. We have hardly things on our hands. 30 years, I don't remember. But we were together with the patients. And that's the way we were. And I think I'm not taking a longer time. And congratulations to all the GNM students. And let the Lord bless you all. And let good things happen. And all you have to wind up saying that, get on to the Lady of the Lamp. And always remember the 3 things that she has taught us. And also together with obedience and respect to your seniors.
अपने संबोधन में स्वास्थ्य सेवा निदेशक डॉक्टर सुजा एंथनी ने इस पेशे के महत्व को स्वीकार करते हुए अभिभावकों से अपने बच्चों को मरीजों के प्रति समर्पित और दयालु बनने के लिए प्रोत्साहित करने की भी अपील की।
The only thing I want to say is that you have chosen a profession that is very, very different from any other profession in the whole world, because nursing is not something that everybody can do. So if you have chosen this profession, that shows that you have a passion for it and you want to serve the people. So that is why you have taken this challenge of being a nurse. To the students who are joining this noble profession, all I have to say is these 3 years that you're going to be here, please put in your best effort, because unless you are skilled, you will not be able to give your full attention and full service to the people. You are there from the birth till the death. You are the last person whose hands a person will hold before he leaves the world. So make that both the birth, the death and the time in between memorable for people dealing with you. So take your time, study well, learn all the skills that are required for a nursing profession, and in the 3 years, I think you should imbibe this special skill of being compassionate, of having empathy towards your patients. Medicines do work and medicines will take its time to work, but the care that you give, that is what is going to make a difference to the healing of the patient. So my best wishes to all the first year students here. और पेरेंट्स जो यहाँ पे उपस्थित हैं, उनको मैं यही कहना चाहती हूँ कि आपने बहुत बड़ा एक कदम लिया है अपने बच्चों को नर्सिंग प्रोफेशन में भेज के। ये एक ऐसा प्रोफेशन है जिसमें बच्चों को अपना पूरा लाइफ देना पड़ता है। कोई टाइम नहीं रहता है इसका कि मैं 6 से 12, 12 से 6 काम करके वापस चले जाऊंगी या जाऊंगा। ये एक लाइफ लॉन्ग डेडिकेशन है, क्योंकि वो जो डील करते हैं वो पेशेंट्स के साथ है, जो बीमारी के साथ डील करते हैं, कोई नॉर्मल व्यक्ति के साथ नहीं। हम जानते हैं कि आजकल बहुत मुश्किल हो रहा है नर्सेस को अपना काम करने के लिए, क्योंकि लोग बहुत ज़्यादा डिमांडिंग भी हो गए हैं। बट उस सब के बीच में भी नर्सेस को अपना स्माइल बनाए रखना है, अपना कंपैशन बनाए रखना है, अपना आवाज़ प्यार से उनको डील करना है उन पेशेंट्स के साथ में। तो ये सब बहुत बड़ा चैलेंजेस है, क्योंकि हर कोई नहीं कर सकता है, और आपके बच्चे इस प्रोफेशन में आए हैं तो ये सब करना भी पड़ेगा। तो मेरा आप लोगों से, जो पेरेंट्स यहाँ पे उपस्थित है, आप लोग से यही उम्मीद है कि आप भी अपने बच्चों को एनकरेज करें कि आपने जो ये प्रोफेशन चुना है तो उसमें मन लगाकर पढ़ाई करें, स्किल्स गेन करें, और उस कंपैशन और उस प्यार से पेशेंट्स के साथ डील करें, ताकि वो लोगों की सेवा कर सके और लोग याद भी रखें। सो ऑल द बेस्ट, माई बेस्ट विशेस टू ऑल द फर्स्ट ईयर स्टूडेंट्स present here. And I'm proud of the school also, the nursing school, because as I said, whenever I've been fortunate to sit in some of the interview boards of various selection committees, and if a candidate answers very well, I invariably ask them कि कहाँ से पढ़ाई की है, and 90% it will be from our nursing school. So that is a very, very proud moment. It is not just one selection. I have been in many selection committees, and our children perform very well in interviews. So my congratulations to the faculty, to the principal and the faculty, who are doing a wonderful job in training our nurses. So all the best, keep it up, and I wish that this school will continue to produce many more talented as well as compassionate nurses.
जीबी पंत अस्पताल के चिकित्सा अध्यक्ष डॉक्टर M.K. साहा ने नर्सिंग पेशे में ज्ञान, कौशल और सहानुभूति का सार समझते हुए सभा को संबोधित किया।
By lamplighting, we used to think the conventional lamplighting that we see as a colonial hangover. I guess you get the hint. So whenever there used to be any program, so it used to be started with a lamplighting. But this lamplighting is way different from that. So something extraordinary, and I am indeed delighted more than anything else, because some of you are being inducted into the glorious tradition of nursing, because this particular profession is way different from any other profession, or rather many other professions, because it's not just getting a certificate or diploma or degree, but this particular profession is associated with service to humanity. As Madam has already said time and again, the care and compassion, so those are the important ingredient of the kind of service that you render. During this 3 years training, as you know that you will be made to learn lot many things. There are 3 components in learning, that is knowledge, skill and attitude. Knowledge will be imparted by the teaching faculty. Skill is the hands-on training that you will be given, because just learning a book, if you could be a nurse, then anybody and everybody can just buy the book from a shop and then claim himself or herself to be a nurse. But that's not the case. So you have to acquire the skill, because one thing we should never forget, that every single individual is different. Although anatomically we are same, but every one of us look different, that you know, and that is how we recognize each other. Likewise, our physiology is also different. So every single patient is different. That is the essence that you have to always remember. Okay? And the attitude, the third thing, and one of the most important thing that you should remember. As time and again it has been said that how a nurse behaves with the patient or attendants, that makes a great deal of difference. Because doctors would come, see the patient, give some advices and then disappear, to be honest, unless he or she is called again. But the nursing faculty, nursing personnel will be there round the clock. So a person gets maximum treatment from the nurses than anyone else. Doctor, and then this training program also will help you learning the thing that even if a doctor says something, you are entitled to correct the doctors at times. You are not just subservient to whatever the doctor advises you and blindly follow it. You can exercise your knowledge and discretion to see if anything wrong the doctor has said. You are always welcome to say, the doctor, you said this thing, will it not be better if we give this? And we always welcome this, to be honest, because you know, I came here 24 years back, whenever I used to get a call from labor room, Dr. Arpita, Suja and all medical officers I knew will say, then first thing I used to say, is there any nursing personnel there? Then they say yes. I say give the phone to her. The reason is that because they are associated with the patient for all the time, they know the progress of the patient. Because the medical officer may come, just appear and call me for help. But it is the nurse who are much more trustworthy than the doctor at that point of time. And I used to decide whether the patient should be allowed to go into labor or to do cesarean straight away over the phone when we had very few number of specialists with us. So that is the trust that you have to gain after this lamplighting ceremony. It's not just a certificate that we are going to highlight today. Okay, it's a life of dedication and devotion, because anything and everything you do, it will be focused on this particular ideologies of the legendary personnel, that Florence Nightingale, who is known as the Lady with the Lamp, because he is known world over for the kind of devotion that she has shown while treating or tending the sick and wounded of the Crimean War personnel. Okay, so you have to uphold the traditions, the faith, trust of that particular profession for the rest of your life. So teaching, or rather treating a patient with care, skill, compassion is your motto, and that should be the first thing, or rather the priority in your life from now on, and everything else is secondary. Remember it. But the same way as a doctor profession also does it, and you are no different, because you are very much or intimately associated with the medical profession. So your behavior, your attitude, everything should be for the betterment of the sick and injured. And you dedicate yourself. If you see it, you will get the utmost satisfaction that you deserve, that you have shown your passion to. It should not be treated just as a degree or certificate to acquire a job. No, you have already dedicated yourself to a profession of the highest standard, and you must live up to the tradition with this.
कार्यक्रम में स्कूल ऑफ नर्सिंग की प्रधानाचार्य हफ्सा बीबी ने उपस्थिति सभी आला अधिकारियों और विद्यार्थियों का धन्यवाद किया।
I extend my most sincere thanks to the Almighty God for making today's event a resounding success. From the depth of my heart, my sincere thanks to our chief guest, Dr. Mrs. Suja Anthony, Director Health Services, not only for sparing her valuable time for us and to grace this occasion, but also the word of inspiration. Thank you, ma'am. My sincere thanks to our guest of honor, Dr. M.K. Shaha, Medical Superintendent, Jeepanth Hospital, for a valuable presence here also, and for encouraging the words. For your encouraging words, thank you, sir. I extend my thanks to Dr. Arpita Shaha, Additional MS, for gracing this occasion with your warm presence. Thank you, ma'am. My heartfelt thanks to our special guest, Lieutenant Colonel Y.T. Minimol, Matron in Charge INH Dhanvantri, for delivering the oath to the students. Today we had an opportunity to hear your thoughts, and this will surely encourage us all in our future endeavors. Your words of compassion, commitment, and competence will always remember. As you know, you have always used to say, nursing is learning by doing, not by reading. My sincere thanks to Ms. Johanna Riaz, Matron Jeepant Hospital, and all the senior nursing officers for your valuable presence and have motivating these budding nurses. I also thank the faculty of A&M Training School for sincere present here. My sincere thanks to all the parents who came from different islands to witness this remarkable occasion of their children. Thank you, dear parents. I also thank wholeheartedly the director, ANIMS, and supporting staff for sparing this auditorium for the smooth functioning of today's program.